Hi, we're Design Team 5, and our mission is to better diagnose shunt malfunction in hydrocephalus patients. Hydrocephalus is characterized by the accumulation of CSF in the ventricles of the brain. This excess buildup can eventually lead to death and only present relatively mild symptoms such as nausea, vomiting, and lethargy. Over 1 million people in the US have hydrocephalus, with 75,000 new diagnoses each year. Of these new cases, 20% are children. This problem is exacerbated by the fact that in every 1,000 births, a child will be born with hydrocephalus. Unfortunately, that means hydrocephalus has become the #1 cause of pediatric brain surgery, with the disease being currently treated by the implantation of a CV shunt to redirect the excess fluid to the peritoneal cavity. What further complicates the problem is that patients with hydrocephalus exhibit non-uniform flow, ultimately making current industry standard shunt monitors ineffective due to lack of personalization. However, shunts have a short life expectancy, with 50% failing 2 years post-implantation. Chiefly amongst these failure modalities are obstructions in the proximal or distal catheters of the CV shunt, which account for 56% of total malfunctions. Combined with failures from disconnection and fracture, the majority are a result of mechanical failings and not infection. Therefore, patients with cerebral shunts and their physicians need a way to monitor shunt function in real time in order to improve the acuity of patient self-diagnosis and lower the risk of injury and mortality. By decreasing unnecessary visits and reducing the false positive rate, we could create a product that would provide a better, more definitive diagnosis than the standard of care, simply because it would take place before any imaging or revision procedure. Taking into account that children with hydrocephalus often have 1 to 3 regular CT and MRI scans every year, they incur a cost to their caretakers of often $1,000 to $2,200 per scan on average. This doesn't even begin to consider the cost of a shunt tap or revision, which have a median expense of $5,500, and if not caught in time can lead to a fully malfunctioned shunt and ultimately the death of the patient. It is therefore important to acquire functionally continuous monitoring of data in hydrocephalus patients because the standard of care has yet to yield an innovative solution that can provide more than one discrete time point. One such popular technology that neurosurgeons often rely on is shunt check, which relies on the principles of flow thermodilution to externally diagnose if a shunt has adequate flow or not. The ultimate problem with solutions like this is that they still incur ER admission costs and don't take into account the flow rates of patients present while shunt function is normal. Therefore, a truly novel solution to hydrocephalus must take into account the non-uniformity of CSF drainage to determine if shunts need to be replaced based on each individual patient's normalized flow rate.